Well, good evening, everyone. We thank you for joining us today. You are tuned in to LKM Kingdom Living Leslie's Lessons Learned, and we are here today with my beautiful cousin, Dr. Sabrina Thomas, and we're going to be talking about women's health today. Let's get started. So as you know, we're on. Oh, hey, Ed Marie. So thank you for that you're here. We're on every Sunday in the morning at 9 a.m. Eastern time, and we're on once a month. Well, it seems like it's turning out to be twice a month on at 5 p.m. Eastern Time on Sunday evenings. And today I have, like I said, my beautiful cousin with me, and I'm so excited that she's going to be here talking about women's health, helping us get our lives in order as women. Sometimes, we take it for granted and we take care of everybody else and we say, oh, we'll do it later. Even in pregnancy, there's some women in pregnancy that don't even make it to the doctor hardly. So we want to talk to her today, or we're going to let her talk to us. And she's going to introduce herself. I want to say, hey, Lady Doreen, uh, I haven't called y'all out in a while, UK and London and those from the islands and all across America. Thank you for being here, even if you come on later. But would you take a moment, hit that like sign, subscribe, and share? We would love for others to hear in this conversation that just take themselves for granted. So, Sabrina, first tell us a little bit about you. You've been in this field for many, many years now.
Yeah.
And, you know, I'm going to let you greet the audience and just tell them a little bit about yourself.
Okay. Well, it's an honor to be here. First and foremost, child of God, thankful to have been offered the opportunity to travel this unique journey. Definitely where I am placed to be, and it's just an honor. Want to thank you for inviting me.
Oh,
I just have all these fond memories as a little girl, being the little cousin
my
going
little cousin.
Jersey, and, I was a city girl, so going to
Yeah.
Jersey and having the wonderful experience of visiting with you all, and the highlight was always that my dad, loved ice cream. So we visited the creamery every time we came, so
Everybody from New York, everywhere they came.
there was never a time that I missed that trip for, a lot of reasons, but that was literally the icing on the cake, so
Yeah.
very happy to be here today. So, wow, my journey. I've been practicing clinically since graduating residency in 2001. So this summer makes 25 years.
Wow.
Because
Yeah.
we go through 4 years of training, I've actually been practicing for almost 29 years. And I think one of the honors of my career has been folks who say to me, I guess, it's the blessing and the curse, right? Say to me, there's no way you could have been doing this for this long. You
I
don't
know.
look like
You
you're,
look so young. You're so young.
and I say to them, well, I color my gray hairs very well. I have a 27-year-old and 21-year-old twins who can testify to my age. I didn't start doing this when I was 5.
Right,
Uh,
right, right. It seems like
and
it though when I
I
think back.
I know, and, I have amazing genes, which, I thank my mama and my daddy for, because cousin Leslie is on my daddy's side, and everyone can see how beautiful she is, and so
Oh, I didn't. Your father was my favorite.
yes. I'm surprised my name is not Georgia, but that's a whole other conversation. Um, so yes, I've been just blessed to be able to be in the positions that God has placed me, and it's been a great journey. So after completing medical school, I decided long ago. I think my mom used to tell the story in childhood that I knew I wanted to be a doctor, but for good or bad, the Cosby Show back then was the introduction to positive family life in our communities.
Yeah,
To see successful professionals working in a family environment, it was so encouraging. And of course, I've been blessed to see, our family environment through our immediate family and extended family, because we had some great role models,
we do.
amazing role models. However, we didn't have any physicians in the family.
Right.
And I was so excited about, just learning about the journey. And as I learned more and more, I had to find, those mentors who could also tell me about not just the academic life, but, the social life, the family life, all of the intricacies of this path that was going to be pretty much all consuming. And so, learning from the Cosby Show and seeing his enthusiasm and really being fascinated by the human body and the female body, it didn't take long on my rotations to realize I want to do women's health care. And my primary goal actually was just deliveries. But I have practiced full scope for all of the time that I've been in practice in terms of taking care of young, adolescent girls through women in pregnancy, women achieving perimenopause and menopause, and then our more seasoned women. I don't call them elderly. I ask people how young you are,
Mm,
because I have learned that it's a state of mind. And I've met many 80 and 90 years old women who, I would have believed their lifestyle and just the way they carry themselves looks like what I used to see as a 50, 60-year old. And so, it's been really wonderful to have the experience. So I'm board certified. And a couple of my pastimes have been being in the spaces of not only having my own practice for over 10 years,
yeah.
but being in executive medicine sort of role where I've helped hospital systems build emergency care departments for women and pregnancy called obstetric emergency departments, which are critical in many areas. And it's a really wonderful new way that we've begun to practice obstetrics and gynecology, and it's a very wonderful, safe model for patients who are pregnant. And I've been, blessed to be in an academic position where I've, overseen those who are coming behind me in how they deliver healthcare and being a role model for them and how I approach healthcare. And then I've done, other educational events, but I've also done the side of looking at utilization and how healthcare is actually consumed in this country. And so I've just been really, really wonderfully positioned in some rooms that I never thought that I would be in. But I know that it has been on purpose.
Yes.
And I know that it is always for greater purpose. And so I look for those reasons to be able to, move on to the next assignments. So on my current assignment, I'm very content. But on the break, we were just talking about that my next assignment will probably involve international travel and education, because I believe that, seeing the world is part of what I'm supposed to do. And
Yeah.
that there are many environments that I could be helpful with in terms of healthcare education and administration. So I'm real excited about the future.
I,
Mhm.
I love it. I love it. And you've done much. You've
Yeah,
done much, and you've
yeah.
done a great job at it. And that was one of the reasons. Well, you were supposed to come on. Was it last year?
No,
When was
last year,
it?
and then we
When?
switched to February, and something came
Because
up.
of your dad.
Yes,
Because of
yes,
your dad, and
yeah, yeah,
um, but you're here now,
yes.
and it's purposeful. Hey, Adrian. Hey, Pastor Daphne. You know, I was thinking about something when you were talking, and one of the things that they say after you get a certain age that they told me every 10 years I don't even know if I should be talking about this, but get a pap smear now after a certain age.
So, we could talk about some of the the myths, right? There's been so much growth in the area of women's healthcare. I also want to say that fortunately, we're now at the point in this country where we're addressing the fact that, a lot of the studies that have been done, we were extrapolating that information to extend it to apply to women, but we didn't have a whole lot of studies of women in a lot of what we knew in healthcare. And just like we treat babies differently, babies are not just little humans that are little adults, right?
Yeah.
You can't just treat them the same way and just, give them the same medications in smaller dosages because their bodies are changing. Um, our bodies are not like men's bodies, right? And so it's really good to know that we are now to the point where we're doing a lot more studies. And even in the field of obstetrics and gynecology, from the time I started training, which I finished medical school in 97, so the late 90s, early 2000s to today, we have had a huge shift in how we practice and recommend to our patients what they should be doing in their lives and how to stay healthy. A lot of things were anecdotal because this was what we were taught, and it seemed like it wasn't doing any harm. And especially in the field of obstetrics, it's very difficult just because of the nature of the work in this country.
Hmm.
It's hard to have studies with involving a mom and a baby, but I will say that we've gotten much better about having, like the other areas of medicine, evidence-based practices where there's some literature backing these things. There may, not be as many randomized controlled trials in certain areas, but at least there are more studies overall that lend to why we recommend what we recommend for women. And so
Hmm.
one of those areas is pap smear screening. Pap smears screening has evolved because we now know that the majority of cancer is related to cancer of the cervix, and that's what pap smears look for: cancer of the cervix or changes that lead to cancer in the cervix.
Right.
We now know that that's associated with a virus. And so, I've been fortunate enough to see that evolution of, coming out with the HPV vaccines and recommending that, our young women get vaccinated. And then now we have extended to say, up to 45, you should consider vaccination if you haven't been vaccinated because of the protections against cervical cancer. And then, in that extension from trying to get the 9 to 12-year-olds in females, we also started saying, hey, you know what, if we're talking about later in life people having intercourse, why aren't we protecting these young men, because they're the ones having intercourse with the women.
Right.
So then we extended to making those recommendations to our males who are at that younger age, just again planning for the future way down the road, not encouraging any behavior, but planning for the future, knowing that if this is a way that women are at risk, how can we best protect all of our society? And that's just one of the perfect examples of how things have evolved.
Okay. So you were talking about the young girls,
Mhm.
the vaccination. Uh,
Mhm.
it's new, but it's not new.
It's not new.
Mhm.
Most commonly, I would say at least, gosh, I remember this being introduced about 20 some odd
Right.
years ago.
Yeah.
And what I was explaining was, in terms of extending the time frame, we used to say, the early vaccine period was age 9 to 12, and then we were recommending it through age 26. Over the last several years, we've said, hey, there's some benefit of giving this to women now through 45. And
Yeah,
so that
absolutely.
has been, one of those things that, again, the more we learn, the more we can apply, the good science to how we're recommending things to our patients. So yeah, so that's what's evolved over time. Similar vaccines, there are now, of course, some additional companies. There are different, shall we say, strains that we're administering. Used to be quadrivalent. There's several different ways you can administer it. However, same concept of protecting women against the most concerning strains of that virus that are related to cervical cancer.
Okay, yeah. And because that's a cancer that sneaks up on you, I would say.
Well,
Um,
actually, it doesn't sneak up. It's not that fast
it's
to
not
develop, which is, the reason why it's so much more important to understand the importance of just routine maintenance. Just like you would maintain your car, we have to get maintenance done on some of our household appliances. The body needs, evaluation and maintenance as well. And so I try to liken it to, a checkup for something else you're very highly dependent on. And in this day and age, it's for most of us our vehicles, right?
yeah.
So you not only go in to change the oil because you know it needs to be changed, but usually you get a diagnostic, right? And so the diagnostic is a part of what we do in the women's health assessment. The great thing about women's health, and the other reason why I love it, is because, for the most part, the majority of the patients I've worked with through the span of their lives tend to be on the younger side of
Some.
things, but I get to follow them through a
Mm,
lifetime. And that's where I can have the impact of encouraging them to continue to come back to see me regularly.
wow.
I think people transition from pediatricians to getting to adulthood, and then sometimes they sort of drop off, and they may not have something until maybe a pregnancy arises. And that's the unique space that I get to be in, where if I'm taking care of you for a pregnancy, I'm catching up on all of those maintenance sort of things, making sure about vaccine history, health history, family history,
Yeah.
taking you through the pregnancy. But then once you're delivered, I'm encouraging you to stay with me. And in those intervals that we see each other, we no longer need to do a pap smear every annual visit.
Mm,
We now space them out every 3 to 5 years because we do the
okay.
specific testing for HPV. And so,
Mhm.
depending on what your specific pap smear results are, I am very cautious when I say to women, on average, every 3 to 5 years. That's if things are 100% okay.
Okay.
And because sometimes there could be little things like maybe there were not enough cells, or maybe there was some inflammation on the pap smear, or because of your own personal history, I encourage women, go annually. You may not need a pap smear, but there's more to what we do than a pap smear. We want to know throughout your lifetime. I can have conversations all day long about your period, whether or
Yeah.
not it's coming, it's not coming, you wish it came, you don't wish it came. you know,
Yeah, yeah,
that's
yeah.
a whole conversation of itself, and it's very important for the lifespan of women to know what's going on with their cycles. So I know that there's sometimes a fear and concern about the pap smear exam, but I encourage women to understand that it's more than just the pap smear exam. We are multifaceted. I try and get through every other aspect of what could be impacting your life, and the pap
Mhm.
smear sometimes is a small part of it, a very important part, but a small part of what we go through on your exam. And if you have a relationship and you build that relationship, you can make that exam so much easier for yourself.
Mm.
Because knowing your story, I can understand what your triggers are, what your concerns are, how to best engage you with having that exam done, so that you're not traumatized by the exam, but we're going in open eyes to just receive additional information to keep you healthy.
Yeah.
um, and that's why I encourage people to, do it on an annual basis, even
Yeah.
though we're not necessarily doing that type of
Yeah.
each
Mhm.
time.
And
Mhm.
and it seems weird, not when you now that I'm older and they say, "Oh, you don't have to come as often." That seems so weird, so weird. But we do have a question in the audience, and one of the things I wanted to talk about, because you mentioned it, was every woman has a different experience with a period, I'll say.
Mhm,
And some have a lot of pain and discomfort. Some,
mhm,
they just can't do anything,
mhm.
when that time of the month come. Is there something that can help with that aspect of it?
The first thing is getting an exam done, seeing a professional who has experience with periods and difficulties, and making sure that you have an exceptional history taken, because a lot of times we can tell things through your history. We'll ask tons of questions. They may seem very invasive. We try to gently guide you through getting those answers, because after that, we make an educated decision about how much of an examination you will need. Younger patients and older patients are typically very concerned about having an exam, even when they're having some issues. But I will say that, it depends on what the symptoms are and what other kinds of modalities we can use to help lighten the load of what needs to happen in terms of that exam, and maybe imaging and things that we need to do and blood work. But there are so many reasons why a young person could have difficulties with their cycles, but there's so much we can do.
Okay.
It's very difficult to give generalized advice,
Right.
because, everyone has a health history. And even if you think it's unremarkable, there may be, warning signs about what's going on in your history and your family history that may make me say, no, this is not a good idea for you. I'll
Hmm.
give you a great example, and that is of migraines. There are tons of
Oh,
migraineurs
yeah.
who they seem to not think that getting the official diagnosis of a headache being a migraine is very important, but it is, because certain types of headaches, which are certain types of migraines, and there's a couple of different types of migraines in general,
Hmm.
um, put you more at risk for having what we call an event that would mirror stroke.
Oh,
When
really?
Yes, basically a stroke when taking birth control type
Oh,
medicines.
yeah.
And these are the estrogen containing typical birth control pills. It now comes in pills, patches, rings.
All
Um,
kind of ways.
so those sorts of things are very important to know, and so it's, one size doesn't fit all, because, you may think, "Oh, I don't have any medical problems." Why can't you just say, "Well, everyone should take the pill?" Well, everyone shouldn't take the pill, and until we sit down and I can tease out some of the background risks you have, it's important to be able to do that on a one-on-one basis before saying that this is your individual risk and why you may benefit, versus maybe we should consider another specific type of medication or other sort of modality to help. At first, when you asked me about talking to women, I thought to myself, now this is going to be the most non-medical medical conversation I'm going to have, because a lot of times, without going into a lot of anecdotal stories and what we used to use as children, people have called it, countryside medicine, bush medicine, whatever. Um, a lot of the common sense things we do that won't cause any harm, because you're not ingesting anything harmful, still applies. So, using a hot water bottle or a heating pad, we don't have as many hot water bottle users anymore.
Yeah.
A heating pad on your belly to try and ease some of the discomfort of the cycles. Making sure that you have an appropriate diet, making sure you exercise. Exercise actually can help with menstrual
Really.
cycles. So, going back to the basics, and I can tell you, for every stage of our lives as women, the things that hold true are: what goes in is what you get out, right? And
Mm.
so if you have good rest, good nutrition, um, healthy mentality and thought process, you tend to have a little bit more success with whatever modalities you try, because those things always improve background risk of having issues. with typical what I call inconveniences of life. And at times,
Right.
cycles are inconvenient, right?
Yes.
They serve a greater purpose, right? And I don't know about you, but every time I've been pregnant, only been twice, I seem to forget when I'm pregnant that I'm upset that I didn't have that I'm happy that I'm no longer having a period because you got so many other things happening, right? So you think the one time that, all these other months of your life, you're like, my period,
Yeah.
and you're pregnant and you got a whole nother set of
Yeah.
concerns. And at some point, I remember in both pregnancies thinking, I don't even remember thinking, oh, I don't have my period. This is great.
Right. 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 Yeah. That's so true.
So it's pretty relative. So I'd encourage most of the time if people are still seeing their pediatrician, some pediatricians go until 18, some to 21. There is a combined medicine pediatrics focus now in medicine. So some of the pediatricians are actual internal medicine docs, so they'll follow you through your
Mm,
lifetime rather. And some folks who see pediatric age patients are family medicine docs, so they can also see you, through your lifetime. So
wow.
I would say if you're having any problems with your cycle, see your healthcare provider. If you're in an age group where you're seeing a pediatrician and the pediatrician doesn't think that with your history and what they can offer, that is enough to help you through whatever your challenge is, get a referral. And if you don't need a referral, and if you're a mom and you have a great relationship with your OBGYN, I had plenty of moms who would say to me, okay, doc, when can my daughter come? When
And
should she?
that's the question. Yeah.
Mhm.
What age?
And so the answer to that is usually, if teens are not having trouble with their cycles, meaning they're not skipping a lot of cycles, they're not missing school and having tons of pain with their cycles, they're not having heavy flow with their cycles. Typically, when they check in with their annual visit with the pediatrician,
Mhm.
that should be one of the questions, and that's fine. They can, stay with the pediatrician until they get older. I do tell my moms that if you have a young lady who's, in high school and you're planning to send them off to college, or even if they're staying at home, if they've never seen a gynecologist and they may not feel comfortable asking a lot of the hard questions to the pediatrician because they've known them since they were 5, and every time they walk in they pinch their cheeks and say, oh, you've grown, which I love pediatricians. It's an amazing relationship, but sometimes that's a little intimidating, right? And they know that uh, the mom knows, the pediatrician real well because the family dynamic has been that all 5 of the siblings have gone to the pediatrician. That makes it a little bit difficult to have those conversations. So especially if my patients also, I'm quite honest and open with them about developing a relationship with their children as a patient, and I explain to them whatever the state rules are about me being able to visit with their children and how those exams sort of work. And then I say the same thing to the minor when they come in, and I remind them that there are certain things that I need to discuss with their parents, but I always encourage them, all of them, the same exact discussion we're having to have with their parents. And I also offer them to be a tool for them to bridge the gap between some of those difficult communications, whether or not it's in the office or other, communications, to make sure that everyone's on the same page.
That's good. Yeah. If you have any questions, please put it in the chat. You said something. Hey, Ash. You said something. I was going to ask you about. Oh, um, because of children, young. I'm calling them children, teenagers.
Mhm,
Getting involved sexually and having no understanding. There's a
mhm.
lot of infections and diseases and things out there. And how do you educate? Well, I don't even know if this is the right question because when to educate, you just got to talk to them. But um, some of them, by the time they come to you, they've already intertwined. They already are
Mhm,
involved in intimacy with a partner, and
mhm,
now they receive something, some
mhm,
kind of disease
mhm,
because of it. I don't even know what my question is. Awareness.
mhm,
Awareness. Should there be, well, there are. Should there be more awareness uh, classes or
mhm.
something around? Am I making sense?
Yeah, no, 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 you're making perfect sense. There's different rules in different states,
Mhm.
about, what is considered, a reasonable age to have conversations, whether it's about birth control, whether about it's about, abortion, whether it's about prenatal care and pregnancy. And so each state has its own guidelines. So that's very difficult to sort of make one general statement about, besides saying that there are guidelines. So in each state you're in, the provider knows what the guidelines are. Generally speaking, I think that one of the most difficult things sometimes as a provider is, having the conversation with a parent who's concerned about, painful, difficult menses, and one of the treatment options being hormones. Those are birth control medicines. And I'm bringing this up because this is my general approach to those difficult conversations, and then the more difficult conversations that come when a parent or someone brings, a young person in saying they're sexually active, and not only are they sexually active, but they have an STD, or they heard that the partner has an STD, or they think they are pregnant, or they heard they were pregnant and they terminated, or whatever the case is. I try to stay mindful, that there are a lot of preconceived notions about, what the minor may know or not know. There are programs in a lot of schools that, depending on what grade they're in, they get the talk. The talk is at some point. If it's the girl talk, if it's the girls get the girl talk first, then they get the boy talk the next year.
Right, right.
And that happens somewhere usually late middle school, right? And vice versa for the young men. And so, outside of that, they're having other conversations. And unlike, my generation, generations before, where there were not a lot of open conversations about just even periods,
Yeah,
right?
well, I was getting ready to say I was 9,
Yeah.
and we was in Boston at Aunt Jessie's, and I called my mom and I said, "Mom, I cut myself." I thought I cut myself. And she calls cousin Mary. They're over in the corner whispering. I'm in the bathroom. And she sends Mary to the store. Mary comes back and she gives me the pad. She says, "Put this on."
That was that.
Yeah.
Yeah.
And then I started receiving Sweet 16 magazines that talked about.
Ah, okay, okay, all right. Yeah, everyone's experience, my generation and beyond was, little talk, and a lot of, talk to your sister, talk to your cousin, here's a book, here's a magazine, figure it out, right?
Right.
And so we have the exact opposite issue these days. There is so much exposure.
Yeah.
I mean, way more exposure, before you even realize, there's been exposure to a lot of things. And so sometimes the harder part of my job is not only conveying to that young person and that guardian that, hey, my conversation is not condoning anything. My conversation is just giving straightforward facts information so that everyone here can be on the same page and we make the best or better choices. Um, but there's so much background noise. It almost is a little easier when you have a blank canvas, right? And you
Mm.
don't know what you don't know, and you come in and you can paint it as rosy as you want to.
Yeah. Yeah.
But unfortunately, our children have been exposed to so much, and there's so much trauma, um, And it makes it a very I'm almost getting a little choked up talking about it. It's difficult. M- my most rewarding conversations are with my teenagers who are struggling because of their environment, and they're willing to give me a chance. They're willing to allow me to speak to them things of life, and not to be harsh and condemn them, but to offer them advice and love. And sometimes it's just giving them a hug at the end.
Yeah, I'm my daughter, my one, well, both of them are on here, but Ashley said my experience was my mom telling all the women in the family I got my first period.
But that's also a proud moment, right? You're like, my baby's growing up. They don't see it that way. But,
So
those are milestones, right? I
sorry,
mean,
Ash. But
yeah, no, it's okay.
now my youngest, I couldn't talk to her about anyway. She would go run and hide. I couldn't. She didn't want to hear anything. But I do have some another question for you. But you have experience because you have the two boys and you have a daughter. So in your own household, you had to also
Mhm,
beyond going to work and dealing with everybody else's children, you
mhm.
had to deal with your own. Was that difficult or was it
You have to ask them, but I matter of fact said, "Listen, your God gave you a mama who's a gynecologist, and good, bad, or indifferent, this is what it is." And so I was very open and frank with them about a lot of things, because I didn't want them to hear the narrative of their not so educated friends and be part of a statistic that listened
Yeah.
to people who really didn't have knowledge. And I will say that, I've had my kids' ears since they were very young. You know, eh, in a more positive way, when Kayla was, I never forget, first grade, she would come with me to the hospital.
Did she?
And so she would round with me in the morning, and not in the patient's rooms, but her
Yeah,
school
yeah, yeah.
was around the corner. And so I took pride in trying to get her to school as many mornings as I could. And so, she sometimes was in earshot of a lot of conversation. And, this is just her personality. And she asked me one day, "Mommy, what is sex? Because I hear you asking women if they had sex." Oh, Lord. And then she showed up one day in school, threw her book bag down. Now listen, she's 27 now, so no one can get on me about this. I took better
Right.
care of my children. She threw her book bag down when she got into class, and I never forget, her first grade teacher called me and said, "So I now understand what you do professionally." I said, "What do you mean?" She said, "Well, Kay, when she ran in a little bit late today, she said, 'I'm sorry, we had someone who was dilated.'" Now, having said that, I have very high standards and expectations of my children, because we have been talking anatomy from day one. So, we've had very
That's
frank
cool.
talks about
Mhm.
the who, what, where, when, and why. And, I found that to be very important, because of all the interactions I have, that's always been my biggest fear. Now, do my children tell me everything? Of course not. I also make sure that there are, people in their lives who I can trust. I also pick providers who also can't tell me anything, but they, have a relationship with me, and they understand who I am as a person.
Right.
And making sure that they have similar, or understand at least, my value system, and what my expectations are in care. And so, you don't have to be in healthcare. You can understand your rapport with your provider, and it's like anything else in life. Some people, you feel more open and welcome to have extensive conversation, and those are people, if you feel that level of trust, that usually extends to, the rest of your family having that trust. But I definitely had all of the tough conversations, and my children were probably like, "Oh my God." And not probably. In fact, I do remember middle school. When we moved, I we relocated from elementary transition to middle school with the twins. And I remember the first twin I had the talk with, because I knew that they were about to see the movies and all that other stuff. And I'd been preparing them. But I had a conversation about expectations and things that I was hearing were happening in the communities and stuff. He walked out and he called. I said, "Go get your brother now." He said, "Good luck. You don't believe this." But again, I'd rather they have that shocking conversation with me so that they can come back and give me some feedback as to
Yeah.
what else they're hearing.
Oh,
And,
yeah.
so I don't know. You'll have to ask them at a family gathering one day,
Yeah. Yeah.
1 to 10, how difficult was it having your mother as a gynecologist? And you have to stick me a little note to tell me, "Girl, this is where they are in life because of you."
That's funny. Yeah, because most of my education was on the playground. The
Mm,
girls sitting around on the playground talking about it.
mhm.
And yeah, you said uneducated. They were just telling us what they knew and saw or heard from their older siblings,
Right,
you know.
right.
And yeah, we were just girls having girl talk,
Mhm, mhm,
but like
mhm,
you said, there's so much talk out there. Um,
mhm,
and we seem to trust our friends that we're around,
mhm,
to think that they know exactly what they're
mhm,
talking about. And it's so
mhm,
important that we do engage with our children. And
mhm,
they're not really children at that point. Well, no, because there's children out there that, like you said, your daughter, that want to know information. So, um, from what I was told is when they ask, you tell. I don't know
mhm,
how, true that is, but I do want to transition for the last few minutes on pregnancies,
mhm.
taking care of yourself uh, as a pregnant woman, or taking care of what prenatal care and
Mhm.
what benefits you actually get from, taking care of yourself. I don't even know
Yeah,
if that's the correct way.
I
You take it and
I would say that, probably one of the best things you could do is make sure that before you get pregnant, you have what's called a preconception visit. Even if you haven't, um, had a regular exam, just trying to figure out where you stand in your health care. I think it's so important to just, even if it's been a minute since you had a pap smear, if you're thinking of becoming pregnant, then you owe it to yourself. You owe it to your body to try and figure this out as early as possible. So I would say just making an appointment. But if you happen to be like most people, and you learn that you're interested in pregnancy when you're pregnant,
when you're pregnant. I thought I had the flu.
then you just go as soon as possible to figure out how far along you are. And we start at whatever stage you come in. It's always easier the earlier it is to try and unravel some of the questions, because just like you're concerned, we're concerned too. We want to make sure
Mm,
that we don't have surprises in your health history, in your genetic history, your family history, so that you can have a successful outcome. It's a joy being a part of someone's life when they're welcoming in, another family member. And sometimes the time is difficult in the transition, and I've definitely seen women go from doom and gloom, like, how did this happen, to just blossoming into enjoying and having a good experience. And I've also seen the reverse, where people have had really bad outcomes, and then they're on their subsequent pregnancy, and how did they not have tons of anxiety getting through that pregnancy. So I would say the earlier you go, the better. Preconception visits and planning are great. They do things like not only just examine you, but talk about your immunization history, talk about what you should be doing in terms of things to avoid. Definitely with travel these days, we were so concerned about the West Nile virus and Zika, and then we
Right.
got to
Yeah.
COVID, and people forgot that, well, there were other troublesome viruses that we were
Yeah.
worried about. Now there's a resurgence of the measles. People are getting syphilis again at alarming rates. I mean,
Mm.
there's so many things, but there are things that are also specific to certain areas, in the country where you are, regions of, the states that you're in. So I would make sure that you're, reaching out early. The great thing is that, um, for the most part, unless there is something in your history in terms of your citizenship or ability to receive care, most patients can qualify for care even when they didn't qualify for care before they were pregnant. So,
Oh.
finding out about those things early. There are
Mhm.
local health departments that put people on a pay scale and have social workers to help people figure out how to get care. So, that is the
Mhm.
best message I can give anyone. Go in, get that pregnancy test with a Planned Parenthood. I'm not plugging for Planned Parenthood or any other organization. I just know they exist in places where there's a huge need, typically around college campuses and other areas of the city where people traditionally will go for that urgent level women's care, right? So communicate with them about your fears, concerns, or potential pregnancy so you can get an exam done. And like I said, the state health departments, they're there for that reason, so that you can get the resources to get plugged into care as soon as possible. That's always the best case scenario, because then you can explore all of your options early on. God
Mhm.
forbid there's some concern about the pregnancy, and you can make really good decisions about, is this something that is meant to be, or, deal with earlier on the realities of what is going to occur that, we have no control over, but we can help you navigate as best possible. So
Mm.
that's
Yeah.
my recommendation. Pregnancy can be a wonderful time, but it can be an incredibly stressful time too. And
Mhm.
so it is our joy and pleasure to partner with our patients early on to give them the best outcome possible.
My last two questions, because we're
Sure.
at the right. One is, if someone is looking for a gynecologist, what
Mhm.
are some of the things to look for? And you might want to answer this one first, since we were talking about pregnant women. What is it called? Oh my God, it just slipped my mind. After they have the baby, they go through depression,
Postpartum depression.
postpartum.
Yes.
Yeah.
So, in terms of picking a gynecologist, there's the old-fashioned way of basically what's your insurance, going down the list. I said something really important early on about, how I inherited a lot of my teenage clients, patients.
Yes.
Talk to your friends. You're having conversations about other things. If you've had an interesting experience, you're going to share that anyway, right? When you hear of these things, if we have all these forums and opportunities to be in a group where we're having coffee conversation, and it's time to get your mammogram, talk to your family and friends about all of the life events that are important for everyone in your
Mm.
community, right? So it's time for a colonoscopy. Your partner had a colonoscopy. Your mom's going through memory care support because she has symptoms of Alzheimer's. Bring your community together to talk about these health issues as well, and use their resources. If I've had a great experience with my primary care doctor, my primary care doctor would be honored to receive patients as a recommendation from me. That's the highest honor I can receive as a provider, is for
Mm.
you to tell your family and friends, listen, and again, it may not work for them in terms of the same level, but honestly, typically when we've had similar life experiences and we're going through life together, there's something about our community experiences that can extend to other people that would make so much sense to make their experience in medicine much more positive. Unfortunately, as a society, our culture has not had the best experiences. That's
Right.
a whole nother conversation.
Yeah. Yeah.
However, there are, lots of wonderful, caring, concerned, just involved physicians of color, not to mention who are culturally trained enough
Yes.
to give you the compassion and care that you deserve. So talk to your friends. That's the highest, regard that I can receive is if I'm receiving a patient from
Mhm.
friends or family. And then you talked about a super serious topic, which actually is also under my umbrella of things that are really on my radar. I
Mhm.
recently have had more involvement with something called postpartum mood disorders. PSI is a perinatal mood organization that internationally and nationally offers support in terms of classes and trainings for not only providers but other organizations and caregivers, community caregivers, to support women who have postpartum mood issues, depression, anxiety, if you have a longstanding history of a psychological condition, to make sure that those things are addressed. If you have a history of depression or anxiety, you are more at risk of having an event postpartum or peripartum just because of
Mm.
all the hormonal changes. And so that's not the time to say, "Oh, I'm stopping all my medicines because I'm pregnant." Have the conversation with your providers about what your feelings have been, how you've been doing, and make an educated decision with your providers about the best care for you, because sometimes it is the best of all scenarios to be on the safest possible medication so you can give your all to your pregnancy. Neglect happens with pregnancies where moms have stopped taking medication and they can't bond with their babies because they're having
Yeah.
issues. So it's very important to understand that this happens. It happens even if you don't have a history. It's a very common thing, and I look forward to the day where not only do we destigmatize all psychiatric conditions because they are health conditions, but that we specifically destigmatize those related to women and delivery, because these are critical moments. They are usually only short lived transitions in hormones, and there's no need to fear them. They are normal feelings that people can have, and we can help. We can help. And so there's organizations, again, PSI, which is Postpartum Support International, is a wonderful group. PSI that is now in most states. If there's not a chapter in your state, you could certainly call or resource the national offices. There's plenty of support portals that are available and things to do in every state to most states. I shouldn't say every state. We're growing exponentially, but to
Okay.
make sure that we're giving moms the support they need.
That's nice, and, we you're not really, you work from home now, but,
So
um
my full-time, calling right now is I am doing more, utilization review. I do have a small concierge, more of a consulting situation that I use to be able to be a resource as pretty much second opinion, and to be an advocate for patients. Would love to be able to share that information as
Yeah,
I
I wish
grow
I
this aspect of, yeah, yeah. And I can actually give you that information and you can post it later, or whoever's interested can contact you directly. I'm
yeah.
actually in the process of building that, because just this past fall, I transitioned into doing a lot more of the utilization evaluation of how we're actually using healthcare, and transitioning into this other phase of being able to assist one on one, because advocacy is huge. I've been able to be an advocate for my patients, for my family. It's been a whirlwind situation to look at some of the situations I have been blessed to use my understanding of healthcare and the healthcare system, specifically even for my dad. As you know, my dad was chronically ill for many, many years, and that was very difficult,
Hard.
but
Yeah.
necessary journey to help him be able to achieve the greatest comfort that he could given his circumstances. So I think this
And
is
then
also
your
a
mom
message.
too.
My mom as well. My mom
Yeah.
was such a
Mhm.
trooper.
I used to love her.
Yeah, she transitioned at a young age of 66. I'd
Mhm.
always planned on her being with me forever. We had a plan for her to help me continue to raise my children. My all my children knew her and loved her, and she was an amazing grandmother to them and support to me and my ex-husband at the time. But I also helped with her journey, and
Yeah.
my brother, I'm helping him with his journey, and again, I feel that this is part of what I must do as well. And so I think this is a natural extension as well of all that I've learned to be able to help other people, because it's just not all about OBGYN, right? I'm a
Right.
physician, and there's lots of people who expect me to at least be able to engage with my other colleagues to give them the information they need in a language they can understand to make good decisions. So,
Mm.
yeah, so exciting.
So, Pastor Daphne is asking where you located. Um,
So, Pastor, I reside in Delaware presently. But again, because my services are going to be on a platform where now that we have this wonderful ability to communicate all across the world, telehealth is a real thing. And I think it's great that you can just reach across the aisle and just be able to help people wherever they are, and be able to be of good service. So, I look forward to connecting really in the upcoming months as I continue to grow the platform to be able to share with folks and offer them a good service.
yeah, and she said that what does it say? She's thanking you for the information. She said her second child, she was depressed and did not receive
Mhm.
prenatal care until her seventh month. That's
Wow.
something that happens, more regular than we realize.
Absolutely,
Mhm.
absolutely. And so, there's no magic answer, but at least having someone travel the journey with you to make safe decisions. No judgment. What you decide is what you decide, but knowing the true risks of the decisions you're making, whether they are to be on medications or not, try alternative therapies or not, try least invasive things like, just behavioral health and talk therapy. It's amazing how much this new era of what is also happening for women is, some people are calling it, I see online, as the soft girl era, of getting in touch with yourself. But,
Mm.
bonding with nature, journaling, mindfulness, these are all ways that mentally and spiritually we're helping our bodies. And so, whatever state you're in, chronic disease, pregnancy, I'm also very much so a proponent of using these things to help ease our minds and to help our bodies to, help us to achieve our best selves,
Yeah.
because, there's no one answer. There's not a
No
magic pill.
answer.
There never is. There never was. But there's lots of good basic things that we can do, and we can do them together.
Yeah, I love it.
Mhm.
I do, on Thursdays, we do what is called mindfulness for your mental health.
Mhm.
And
Mm.
just 15 to a half an hour, I come on, and a young lady that's her field, and she comes on and she teaches different techniques and talks about things to help us, cope with life, especially
Mhm.
in this season and time and all that's taking place.
Absolutely.
It is so needed. So I want
And
to
it's
thank
not
you.
that deep. People think, "Oh, I don't know how to meditate." One of the first things that I learned that was most helpful? How to breathe.
Breathe. That that alone opens up every.
How to breathe.
Yes.
Most of us do not know how to breathe. And so I, like you, would just encourage people to find those groups and just plug in. Don't isolate, plug in. You'll find someone, there's community out there for everyone. And just make sure you're doing so safely and find someone, who you can relate to, who you feel comfortable with. If your spidey senses say, then trust yourself. And there's something out there for everyone, and you'll be able to find your way, but you got to make the effort. You put in the 80, and someone else will come with that 20, and
Mhm.
you'll see a huge difference in your life.
Yeah, that's great. So,
Mhm.
yes, she does do do telehealth.
Yeah. Mhm.
She's going to give me the information, which I should have had already. I'm sorry,
No, that's
but
okay.
we'll make sure that we add it to the descriptions, and
Sure.
anyone that wants to um, reach out to her or get some information on directions on where to go and how to go. We'll make sure that you have that. But we thank
Mhm.
you for joining us. Those that
My
come on
pleasure.
later, listen, there's a replay. Go back because there was a lot of information that was given. Go back and listen to the replay. Those that come on later, thank you so much for joining us. And I hope that I'm not hoping, I know that there was something that was said that would
Mhm.
make your life a little easier. So as you go through your week, women, please take care of yourself. A lot
Mhm.
of times we're the last ones. We take care of everybody else, and then when
Mhm.
everybody else is gone and it's our turn, we didn't take care of ourselves. So we have so much that we have to either do or we miss because of putting ourselves last. So please take care of yourself.
Leslie, one last thing, if I can just let women know, there's a website. They can go
Okay.
to WPSI.org.
Is it
There
caps or
is
what?
CAPS, yeah. It is a website that talks about what the recommendations are for women for preventive health care. It is a wellness chart. It goes through younger ages to older ages, WPSI. I think it's a wonderful tool. People can go through and say, oh, yeah, I was offered my pneumonia vaccine. Oh, yeah, I've done this. Oh, yeah, I've done that. So you can get some really good information. It's sponsored by our government, Human Health and Services, the American College of OBGYN, the American Academy of Pediatrics, the Nurse Practitioners Organization for Women's Health, and the American College of Physicians. So please check it out. Just go through. You'll be able to see, like, oh, well, I'm over 75. Let's see. Did I get my lipids evaluated recently? It's a
What is
very
that?
nice
What you
resource.
just call it? What
W
what evaluated?
lipids, whether or not they had their cholesterol checked. I'm sorry.
Oh, is
Yeah,
that what it's
lipids,
called?
lipids. Sorry, sorry, sorry. I'm so sorry. I'm so sorry.
That's
Yeah,
all
whether or
right.
not they had their cholesterol checked recently, but it's through Women's Preventive Services. It's the Women's Preventive Services Initiative, and so it's just a really good basic chart to have. And I think it's helpful, and you can share that readily to say, "Hey, did you at least get these things done? You're in this category." It's a great place to start.
Okay, well, thank you so much.
You're
That's a lot of
welcome.
help.
My
And
pleasure.
yeah, and so to everybody, I want you to have a great evening. I want you to know that we're here to just give you information to make your life better. And so tonight was a great conversation. I'm so glad we had this conversation. Somewhere along the line, we're going to have you come back on
No.
and talk about some of the other things that you mentioned, even as far as having positions of color and
Mhm,
what that looks like. So
mhm.
we what I pray that you'll be able to come back on and just give us more information.
Sure.
A couple of weeks I have Donald will be on talking about
Well,
nutrition and
awesome,
also what's he talking about? Social Security, retirement, getting ready for
awesome.
retirement.
Oh, I
So
wanna be on that one. I got to prepare, prepare, prepare.
yeah, yeah, yeah. Actually, I have two ladies that are coming on this month, the end of this month, the 22nd, and they're going to be talking about preparing for retirement as well. So
Mhm.
we've been talking a lot about preparation for retirement, and just giving people insight and wisdom on what they need to do as far as housing their house and what's available to them after they retire,
Mhm.
being vets and just different things. So th- that's my heart. My heart is to just make the audience aware of what's
Sure,
available. So
sure.
thank you so much for coming on, and I want to thank
Pleasure.
everybody for being here. And we will talk soon.
All right. Have a great night, everyone.